Good afternoon and welcome to the St. Clair County EMA COVID briefing. Unfortunately, we are here for another day, day 236, and I'm joined by EMA Director Herb Simmons and Samantha Bierman from the Health Department. Sam, you have more numbers.
We do. They are better than yesterday's, but still not where we would like to be. As of today, 120,013 St. Clair County residents have been tested, which is an increase of 807 from yesterday. We are at 9,679 positive test results, which is an increase of 71 from yesterday. And that does include both males and females from under the age of 1 up to their 90s. Today, our daily county positivity rate is 8.8%. We are at 110,334 negative test results. And unfortunately, are announcing an additional death, which does bring our total for the county to 227. That was a female in her 90s who had unknown health conditions. And as always, we send our sympathies out to her family. For those who have completed the IDPH required 10-day isolation period, we are at 8,657. For state totals, 8,030,713 have been tested, with 437,556 positive test results, which is an increase of 7,538, which, if I'm not mistaken, is the highest one-day rise we have had since we've started COVID. And for deaths, the state is reporting 9,933, which is an increase of 55 from yesterday. For St. Clair County hospitalization numbers, we have 71 individuals that are admitted due to COVID-related reasons, and 9 of them are on ventilators. And regionally, we have 133 individuals that are admitted due to COVID-related reasons, and 16 of them are on ventilators. A little side note before we move on to our congregate living facility numbers. I was on a conference call this morning with our Hope Coalition, which is several hospitals, health departments around the region, and some EMS companies, and we were discussing, the situation with the hospitals and their acuity rate, number one, of patients, but their overall patient status. And every hospital is feeling the same burden right now, which is they are running out of beds. We are seeing it at the outlying hospitals as well as the bigger hospitals. So that has always been an indicator to us as a red light, a red flag that's gone up, and we are seeing it, and they are certainly feeling it.
Well, and as we've talked about many times in the past, just to say we have a bed available, you have to have the staffing to go along.
Exactly.
And as you see from yesterday, just in the county here, we went up from 7 to 9 on ventilators. So, we're seeing an increase, so we're definitely keeping an eye on those numbers.
And again, it's not just where, you can, like you said, not having a bed, it's having the staff, having the equipment. Ventilators are not just, sitting in a room somewhere that they have an endless supply of them. It takes specialty staff to work with those patients that require that level of care. Certain rooms, negative pressure rooms that not, every hospital room is equipped with that capability. So there's a lot that goes into it, not just having a physical open bed.
Right. And as we said, it's all about being prepared.
It is.
We have a plan, but you got to prepare for even above and beyond that.
Exactly.
As we said, you get a major storm happen while this pandemic's going on. 100 people or 50 people more get injured and have to end up in the hospitals. There has to be room for them also.
We have to still plan for life,
Yes.
Not just COVID patients. So moving on to our congregate living facilities that are currently in outbreak status or have previously been in outbreak status. These are cumulative numbers, and we will only announce any facilities that have had any changes. Bradford Place in Swansea has 11 cases and no deaths, which is an increase of 2 cases for that facility. The Esquilin Dammert Center at the Shrine has 61 cases and 9 deaths, which is an increase of 2 cases and 1 death for that facility. And Marca Nursing and Rehab has 6 cases and no deaths, which is an increase of 4 cases for that facility. We do still have some testing available this week, Sunday, November 8th, from 8 a.m. to 4 p.m. at McKendree University, which is located at 400 North Alton. If you need that information at a later date, that will be on the EMA Facebook page as well as the Health Department page. And now I will turn it over to Herb for his update.
And we encourage everybody to go out and get tested. And we've
Yes.
talked about that, the importance of being tested because of people who are being asymptomatic. And we keep beating that dead horse all the time.
And it was actually said by Dr. Zike again today,
Yes.
that we need to test people. You know, we've seen it time and time again. People feel completely fine. They've tested positive and they've been out running errands, being with family. So we need to find out who is positive, symptomatic or not, quarantine them and isolate them so we can slow the spread.
Exactly. We'll go into the zip code report now, starting off at 62230, went up 2 to 296. 62204 went up 3 to 180. 62205 went up 1 to 262. 62206 went up 3 to 553. 62207 went up 2 to 293. 62208 went up 8 to 568. 62220 went up 4 to 713. 62221 went up 2 to 884. 62223 went up 8 to 598. 62226 went up 10 to 1,033. 62239 went up 1 to 146. 62243 went up 5 to 159. 62258 went up 3 to 275. 62260 went up 4 to 194. 62269 went up 7 to 774. 62282 went up 1 to 20. 62285 went up 1 to 167. 62289 went up 1 to 11. And as you heard Sam when she gave her numbers, our county positivity rate did go down, which we were happy to hear that. It was at 14.2 yesterday, and we're down to 8.8 today, which gave us the rolling 7-day average to 8.9, which was at 9 yesterday. Our county positivity rate that we report on daily, Bond came in today at 33.3%. Clinton County come in at 18.8. Madison County 16.2. Monroe County 26.7. Randolph County 6.7. St. Clair was at 7.9. And Washington County was at 9.4, which gives us a regional positivity rate of 10.1, which, it's too high. We've got to get it down, Brian. It's definitely, we go down just a tad, but then all of a sudden we're going back up.
I'm just hopeful that, we've had a lot of naysayers on there that wanted to put a political spin on this, and I'm hoping now that the election's behind us and we see the COVID's still here, that maybe some of those people will step up and adhere to some of these mitigations and help work together, because we're seeing these numbers go up every day. They're not going up in small increments. I mean, we've been jumping. We've been on here talking about, we need help from other counties. Right now, we need help from our county. Yesterday being at 14.2, great to be down to 8.8 today, but we can see those numbers jump up and down every day. And we've got to work better to get that St. Clair County rolling average down below 8 and then down below 6.5 if we even want to try and bring this regional number down so we can continue with some of those activities we have going on here.
Well, and then, we say that all the time, and it's all about teamwork. Team St. Clair, and, 236 days. So it's a long time, and it's going to be going on. It's just not, like we've said all along, it's not the light switch that we can turn it off and on. If it was, we'd have done that a long time ago.
Well, and I'm sure the 133 people in the hospital, and more specifically the 16 on vents, would love for us to be able to just turn this illness off and make them all better right away. But the doctors are learning a lot about this virus. They're treating it in different manners that they've seen to be more successful. But when they're seeing patient quantities this high, that's a concerning number.
It's really concerning, and I wanted to take a moment. I've told you in the past that I personally have lost several members to this COVID. Most recently, lost another a friend of my family and some friends of ours some of their family members follow us. And to Rita, her family, we want to give our heartfelt condolences to you. We know it's been a long battle, but our prayers are with the family. And so that's 8 people that I know personally that have lost their life to this virus. Many more that all of us, Team St. Clair, I know each and every one of you has probably got a family member or a friend or a neighbor or somebody out there that has got this. It seems to be spreading more and more. As you heard Sam say, it's important to get tested. You could be feeling fine today and you can be out doing whatever you're doing, talking to your neighbors, going to the store, and in a day or so you start feeling bad. So it doesn't cost anything to get tested. All of us has had the test done numerous times. So do yourself a favor, go get tested, and let's help get this thing behind us until we can get the vaccine. Nobody knows for sure when that's going to be. We're not going to sit around and say, well, we'll come back and tell you about it. We're going to continue to be here. The day's 236. We wish it would end tomorrow, but it's not going to. And if you think it's going to, sorry, we're not playing in that ball game with you. We are going to continue to tell the citizens of St. Clair County and in the region what the numbers are that Sam and the health department provides to us, the Department of Public Health, and we're going to bring that to you. And we just hope that you understand that we're not making these numbers. We don't reach into a box and pull them out. These are numbers that are compiled, given us together, and there are people out there. 227 people in our county alone have lost their life to this.
And before you wrap up here, we got a comment here, and I think it just begs repeating. Kathy, a nurse here, has just put a message to us that says, I'm a rehab nurse that has been assigned to the COVID unit since April, and I am tired. Please, people, wear your mask. And I think that's the sentiment of all of our healthcare workers.
Well, everybody that we talk to, and Sam, I know you deal with them every day. Our EMS personnel who are out there on the front line, the law enforcement, the firefighters, the nurses, the doctors. We've had the doctors, physicians come on here, and they have told us how tired the staff is because, it's every day is just taking care of these patients is draining.
It is.
And then it's draining on family members, that their loved ones are in the hospital. So I think it's really time that we all step up to the plate. And again, I'm not Team St. Clair, you guys are the best, I'm telling you. It's the ones out there who thought this was going to be over with today, or now I'm waiting to see what the next thing will be that it's going to be over with, and when that light switch goes off again. It's not going to happen. This thing is real. The sheriff was here today. We talked to the sheriff, he said the same thing. All we need is to everybody work together and forget about the he, the she, the whatever you want to come up with and all these complaints, just like this person who just sent that message in now. These are real people. These are real people that are going to work, taking care of our loved ones, your loved ones. And if you don't have the compassion, then please quit following this page, because the people who are following this page are spreading the word that we're trying to work together. And as Brian just said, we've got to step up to the plate even more now, because we've got to get these numbers down. The higher they get, the longer it's going to take us to get them back down there. Think about our businesses. If you want to support our businesses, the best way to do it is wear the mask, wash the hands, and watch your social distancing. And we'll get this behind us. We'll be back with Cindy and Daisy in a few moments to translate this into the Spanish communities. And we'll be back tomorrow for the 237th day with some more numbers.
Mask, gloves, soap, scrubs, TikTok, Grubhub, Twinks, Jocks, Bears, Cubs. Zoom is the new club. 6 feet, no hugs, still beat these mugs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs. Mask, gloves, soap, scrubs.
No school, gym closed. Don't touch these clothes. Need food, this blows. Line at Trader Joe's. At home, gym, fish. Don't come close. Just wave, wave, blow a kiss. Mask for masks. this. Left, right, swiping on Tinder. What was life like? I can't remember. Needing my haircut, somebody shave her. Where is all of the toilet paper?
Gloves, soap, scrubs, mask, gloves, soap, scrubs.
Okay, dolls, y'all know what time it is. Come on, stay inside and lock the door. Stay inside.